Welcome to the first episode of the Pharmacy Prison Connect show. My name is Hoyan, and it's a pleasure for me to introduce Kanisha Agarwal. She's the founder and creator of Prison Pharmacy Connect. Hi, Kanisha. How are you?
I'm good, thanks. Thanks for having me on PPC show.
This is really exciting. Kanisha, we know each other from the Chief Pharmaceutical Officer's Clinical Fellowship Scheme. I think the first day when we met, you talked about your background being a prison pharmacist, and I was really excited to learn more about this. It's amazing the journey you've gone through, with starting in prison pharmacy, creating more awareness in healthcare around people who are incarcerated. You've been to multiple platforms, spoken to loads of people. Now, in March 2025, you've also been awarded the Pharmacy Industry Excellence Pillar Award, hosted by Chemists and Druggists.
Yes, that's right. Thank you. That was quite unexpected. I went to the event and it was really interesting to meet different pharmacy professionals doing a wide range of things, from community to primary care, and of course myself from prison pharmacy. It's for the recognition of the people who have been with me on this journey, particularly people who are behind bars in prison, about their healthcare and pharmacy journeys, and also for people that have supported me along the way. So other pharmacy professionals and anyone looking to maybe consider a prison pharmacy career. So, yeah.
So maybe we need to move back in time, and perhaps you can tell me a little bit about how did you get into prison pharmacy? What inspired you? Did you go out for a job in there, or did something that just happened and you found a real passion in it? Can you take us back to maybe your earlier career years?
Yeah, sure. So prison pharmacy wasn't on my radar. It was not something I considered at all. What happened was, when I was in my third year, my mum was working in a library and noticed that books were being sent to their local prison. She said, why don't you see if you can get some work experience in a prison, because people in prison must have pharmaceutical needs. I did exactly that. I reached out to quite a few prisons. Eventually, a prison offered me work experience. It took 9 months to get through the process. The lady I was in touch with was very helpful, and her communication was very good. She set up a couple of days for me, and I was able to shadow the pharmacy technician on site. I never realized that work experience would work in my favor, because I didn't think about prison pharmacy maybe a good 4 or 5 years down the line after that. So that was a different work experience. And then I went into community pharmacy during my pre-registration year and did that for a couple more years. Then I transitioned into mental health because I'm quite interested in working in niche areas of pharmacy. At that time, mental health was very much up and coming in terms of people trying to really bridge that gap between physical health and mental health, that mental health is just as important, the parity of esteem, and that we should be looking at people's mental health equally. So I was quite interested in that field. I decided to get some work experience. And it was there that a senior pharmacist said to me, look, one thing you need to remember is to always say hello, because that means something to that person. That really stayed with me when I started to work in prison. Just by saying hello to people really helped. I went into prison pharmacy because I'd completed all my rotations in mental health. This job came up on NHS jobs, and I went for it and applied.
That is an amazing story. I love how something piqued your interest and you followed your path, and it looks like your passion is there now. Can you tell us a little bit about the day-to-day in a prison pharmacy as a pharmacist?
Yeah. So it varies on, say, your banding and what your responsibilities are. But if I was to give you an overview, the core role of a pharmacist is to dispense prescriptions, or rather to clinically screen them, depending on if the prison has a pharmacy on site, a dispensing pharmacy, as not all prisons do. Usually it's dependent on the size of the prison. You clinically screen your prescriptions, make sure everything's safe, everyone gets the medicines they need. You're also responsible for ensuring policies are up to date within the prison. Are your local policies reflective of your practice and procedures? Are there any changes you need to make to the formulary depending on what evidence base is coming out as well? So very much a replication of what you would do in hospital. You would also have multidisciplinary team meetings with the wider healthcare teams. You could also be involved in wider prison meetings, chairing medicines optimization group meetings to see how we can safely prescribe medicines. Prison is a community on its own, and it's very much how you safely prescribe within that community, because you're also restricted not just to your healthcare evidence guidelines, but also the guidelines of the prison. It's about how we provide safe care within that setting. There's also an opportunity for staff to run clinics. I have done minor ailments clinics in the past to support the GPs and the nursing staff. Depending on which prison you work in, you won't always have a GP available every day. Pharmacist role is quite crucial, particularly if you're a prescriber.
Thank you for bringing us some insight into what happens in prison pharmacy. One of the things you mentioned was around formulary choices and formularies that you have within the prison.
Yeah.
Are there any medications that are perhaps higher risk of misuse in pharmacy setting that me and my peers that do not work in pharmacy prison wouldn't know about? Can you bring some examples up for us?
Some medicines are seen as currency. In prison, people don't trade with money. They trade through things like vapes or certain medicines. Some of the medicines that people might prefer are things like pregabalin and benzodiazepines. We are only going to be prescribing these medicines in line with the evidence and guidelines that exist. Everyone's pain is different, but at the same time, these are medicines that can be abused, can be mixed with other substances. Quetiapine as well. A lot of people may have symptoms that overlap with other conditions, personality disorders, ADHD, or even psychotic depression, and the medicine prescribed could be the same. You do tend to see subtherapeutic doses of medicines, so it's about understanding, are we really providing them with the right therapy? Do they need psychological input? Is that dose of quetiapine really doing anything? People like things to help them sleep because it helps time go by. They're not overthinking about situations and circumstances.
Thanks for giving us a little bit of background about the medication, the type of medication that's being used within a prison setting. My next question is about how long have you worked in prison pharmacy? Have you seen changes with regards to healthcare policy? What are the changes that you have seen within your career?
I started prison pharmacy in 2020. It was actually during the peak of COVID. So that was interesting to see how we were managing new people coming into the prison and how we were managing how staff would be medicating. I would say it was quite challenging for the people in prison themselves, and it was impacting staff too, because the way we were delivering care had to be adapted. I have seen policies and changes from that perspective. Depending on what medicines are coming out is impacting the way we provide care. For example, you've got those Freestyle Libre sensors, the continuous glucose monitoring. The device that measures glucose levels needed to be approved by security. But it got to a point where it needed to come from much higher up because a lot of people's medicines were changing. This is a better way to manage people's glucose levels, which is fine, but then we also have to adapt. That was a positive change in terms of policy, whereby people are still having access to the medicines they need, but approved nationally. I can't say I have seen differences in healthcare as such because I've only ever worked in prison whereby NHS England has been commissioned to provide the healthcare service. But it wasn't always the case. The prison was responsible for providing the healthcare service. Then it changed because they wanted the care to mirror what people were receiving outside of prison. And that's why NHS England were commissioned to provide that healthcare service. From my limited experience, I have seen how policies are having an impact, how medicines are changing, how we are having to adapt as well. Sometimes it can be positive for the people we're providing care for, or there can be challenges. And it's very much about how you communicate that.
That's interesting. When you were talking, I was just thinking about new medication that's coming out all the time. And some of them, perhaps you'd need some sort of monitoring requirement that is more frequent. How can you provide the service within prison pharmacy?
We do have nursing staff available. If we need any blood tests done, physical observations like a blood pressure check, weight, etc., we work together quite closely. And it's about communication, letting them know that this medication requires this level of monitoring. I will make it known verbally, but also send a message to the nursing team and put it in the individual's notes. So if there is anything like that, it's always about keeping the communication clear and making everyone aware in the best way possible. I think that is very important, particularly in a prison setting whereby sometimes people can just be released or transferred and you don't know about it, especially if you're working in a remand setting where someone hasn't been convicted yet. There is quite a heavy influx and outflux of patients. At least if that is all in their notes, the next prison could see, okay, this is what was part of the plan.
I suppose one of the questions that would be interesting to know more about is around transfer of care. How do you ensure that the care is maintained? Do you do discharge summaries?
Quite recently, NHS England have rolled out the electronic prescription service for people being released or going to court. We can generate an electronic prescription, and if that individual is released without prior knowledge, there will still be a prescription for them to access in the community. They would need some details of their own. Sometimes the community pharmacy may ask for ID. That's just to be wary of. But otherwise, they can go to any community pharmacy, give their details and say, look, I used to be in this prison. I've just come out. There should be a prescription for me electronically. So that would help with the transfer of care when people are being released. If someone goes to court, that is useful so that staff can go quickly to a community pharmacy and get that medication for that individual. Those are some of the most recent things to make sure that transfer of care is not affected. If someone is going to another prison, we should be sending people with their medicines. We cannot assume that the next pharmacy will be a dispensing pharmacy. So ensuring that people go with their full supply, that any medicines that are on the wings, anything that is in the dispensary, all of that is sent with that individual. And you communicate it as well if you know where they're going. I've had that happen for a controlled drug like morphine. The previous prison was very helpful. They sent us their discharge summary. They said, these are the medicines that this individual's on, just bearing in mind in case you need to have anything ordered in. Transfer of care to and from hospitals can be challenging. As pharmacy staff, we usually have very good connections with other pharmacy professionals no matter where we're working. I think it's important that we exercise that and communicate with hospital pharmacy staff if we want to confirm medicines as part of medicines reconciliation.
That's brilliant. I think it's great to hear that digital transformation is helping that journey from the person going in a prison setting back into the community. And I suppose from an individual perspective within the prison setting, they get help or there's some sort of oversight with adherence with certain medication. Once they are transitioning back into the community, perhaps that could be challenging for some people.
There's two things that I'll mention. There is a challenge with transfer of care because sometimes our system doesn't always sync with the community systems quickly. And I have had a situation whereby a doctor called me directly into the prison to state, oh, this man is presented to us. And I've gone into the record and I've realised actually he was released a couple of weeks ago. They wanted to confirm what medicines this individual was on. It seemed their system hadn't synced up and that was 2 weeks later. It can be challenging when people are being released, particularly if they don't have anyone on the outside that can support them. And it's funny you mentioned that because there's a lady that I've spoken to and she said, if you want to help people within the community get the best out of their medicines, there needs to be someone outside the prison to help direct them. Because a lot of the times when people are being released, they will consider first and foremost housing and food. Food and shelter mean the world to everyone. Without those basics, you won't consider medicines. It's important at that stage of someone leaving prison that a pharmacy professional is there to provide them with something to say to them. This is your pack. If you are on medicines, this is how you can get access to pharmacies. You know, the NHS app. It's about directing people to that to state, look, if you are going to be living in this place, once you find out where you're going to be living, you can go online or on your app on your phone, if you have access to those means, and find a pharmacy close to you. I think we don't do enough to promote it within prisons, but it's about having a member of pharmacy staff at that point when someone is being released to support them into the community, whether or not that individual has a family member, a carer, a friend. So I think those are some of the gaps that we can close to help people, but we don't always know where people are going to be living when they're being released.
I think a lot of people would need that extra piece of support when on their own feet. When a prisoner, I shouldn't say prisoner, should I? I shouldn't. Question regards to when a new individual comes into the prison, what would the first step be from a pharmacy perspective? Do you do medication reconciliation? How do you find out about what medication they're on?
medicines reconciliation does happen, it can be remote or it can be face-to-face. I think the best way is to do a face-to-face clinic. So making sure that you are sat, maybe not in reception. So reception is what it's called when that individual first enters prison, because they're being received into the prison. And at that point, they will have a health check and critical medicines will be prescribed at that stage. There is also a second day screening whereby they will have a bit more of a detailed check of their medicines. That is a very good place for a pharmacy technician to sit. Even a pharmacist doesn't have to do it. I've seen pharmacy technicians run the medicines reconciliation clinic face-to-face, whereby they're able to gain a very good history and be at that place to say, do you really need this medicine? Do you know what you're taking it for? Or do you think a dose increase is needed here? And that's where these open conversations can happen and open up the doors to pharmacy, let individuals know when they can come to the meds hatch to collect their medicines or what timings the hatch is open. I appreciate it as an overload of information for that individual, particularly if they've never been to prison. But medicines reconciliation is not only good for finding out about someone's medicines, but also about informing the individual of what the pharmacy service is like in the prison. I think it works both ways. So I would say that's a really good opportunity. And if you deem someone to be suitable to have their medicines in their possession, i.e. they can collect it monthly, then you can also do a spot check to check, is that individual taking their medicine safely? Do they have too little? Are they forgetting maybe that they've already taken a dose, or are they forgetting to take doses? Just as you would in the community, you'd call someone up, maybe someone that's taking medicines in a dosset box, and you check with them, oh, how are you getting along with them? It's the same process which you can do in prison. It just depends on how you apply them to the setting.
One of the questions that intrigues me is, what about specialist medication, for example, oral chemotherapy or HIV meds? Do you supply them? How does that work within the prison setting?
So it would require a referral. The individual would have to be referred to the hospital. It's about having that communication with the consultant, with the pharmacy team, and they would be supplying the medicines and letting us know this is what we're sending and how much we're sending, and making sure that is communicated in the notes as well. If any blood tests are required on site in the prison, the hospital need to let us know so we are aware, or let the nursing staff know. And we need to make sure from our side that it's actioned. We need to communicate it back to them so it doesn't affect that individual's care. It's about timely referrals, making that individual aware if they're having any concerns with their medicines. They need to let us know straight away because the hospital is monitoring them, so we need to feed that back.
Do you discuss these cases with the GP overseeing the care?
There are wider discussions for sure, like an MDT is a multidisciplinary team meeting whereby you have the GPs, the nurses, head of healthcare as well, to make sure that we are doing everything that we need to be doing for that individual.
So when the individual is ready to transfer out from the prison setting back into the community, there is a discharge process?
Yep. Varies from prison to prison, but essentially it does vary actually depending on the category that the individual is in. If an individual is in a remand prison, we won't necessarily know when people are going to be released. It could be very last minute and they may have already gone before we can even get their medicines ready. But if you're in a prison whereby it's more stable and you know the date of someone's release, we will of course have their medicines ready. If anything needs to be ordered, we'll ask the doctor to prescribe discharge medicine so we can order them in a timely manner. They will see a nurse before they are released to inform them how to get their medicines. Do they need to go to a community pharmacy for that electronic prescription? They'll be given their medicines. They'll also be given a discharge summary. So there is that support there from the medicine's perspective.
So the discharge counselling is mainly done by the nursing team. I think about the value that the community pharmacy can provide, because they're one of the only professional that you can just walk into and see and speak to about your concern regarding health. You wouldn't possibly be able to go and see a GP or a nurse without notice. Kanisha, can you tell us a little bit about the type of conditions you tend to see within prison pharmacy?
First and foremost, if someone has a heart condition on the outside, that individual is inevitably still going to have that heart condition within the prison. So I think let's not forget that, because a lot of people tend to think that in prison, people generally have problems with addiction, and that's not always the case. Yes, There are people that are battling addiction. They're also battling mental health. Mental health is huge in prisons. And I would say the mental health in a prison setting is very different to the mental health in a hospital setting as well. In a prison setting, and this is my personal opinion from what I've seen, I feel that everything slows down in prison. On the outside, whilst people's lives has been very fast paced and they've not addressed any problems or issues that they've been experiencing, when they come into prison, when their freedom has been taken away from them, they can't even open their own door without someone unlocking it. All the thoughts, all the feelings come to them because time has now slowed down completely. And so mental health catches up to a lot of people. This is the opportunity whereby people can have psychological support, which again, they probably wouldn't have on the outside. So mental health is huge. Some people are newly diagnosed with HIV and it can be quite a shock to them. Some people could be diagnosed with cancer in prison as well, or they find out that they do not have much time to live. So you do have the same conditions that you would see on the outside inside prison. It's that support that you need to provide them with. You do have a lot more mental health in prison as well. You are also trying to support people that if they choose to continue taking drugs, at least they need to be supported the safest way to do it. It's a much wider picture. It's not you're giving methadone or buprenorphine to everybody, which is what a lot of people assume.
It's interesting to realize that conditions don't stop once you enter the prison. My question is more around mental health, because there are pharmaceutical interventions to treat mental health issues. So they have access to therapies that are not based on pharmaceuticals.
There is a psychology team within prisons and they do have access to group therapy sessions, one-to-one sessions, and art therapy. People engage in that because it allows them to express their emotions in a very creative way. You do also have something called listeners. Listeners are people who are actually in prison themselves, but they are trained to be a listener to their peer, and that's part of Samaritans.
Oh, that's amazing. That's good that service like that also exists within the prison setting.
There's also chaplaincy, as sometimes people feel better speaking to a chaplain about their concerns. So there are different services available. It just depends on that individual as to how motivated they are to approach these services versus taking a medicine. But again, I can understand not everyone likes to talk to strangers about their personal problems. Some people don't know if they're going to be transferred within the next couple of weeks. So why would they want to open up that door only to be shut down again?
Yeah, that makes sense. I suppose I want to move on to talk a little bit about Prison Pharmacy Connect, PPC. What inspired you to set up this group?
You and I were both on the Chief Pharmaceutical Officers Fellowship Scheme, and you remember the diversity of us pharmacists. I was the only prison pharmacist there. When I spoke to a few of the hosts, they mentioned I was the only prison pharmacist to have been on this scheme. I thought to myself, why is that? Is the message not being filtered down to prison pharmacy staff that there is a fellowship scheme to expand on your leadership skills? Then I thought, what else are prison pharmacy professionals missing out on? What else do they not know about? People don't even know that this is a career path in itself. From there, it just led me to create something to share with pharmacy professionals that whilst you are considering the traditional sectors of community, hospital, and industry, there is also prison. There is another population that you need to think about. So that was the first thing. It was just to raise awareness and bring the profile of prison pharmacy aligned with the other sectors. But at the same time, everyone's experience of healthcare and medicines in prison is very different, as is each of ours whenever we go to a hospital, but no one talks about it. So I thought I want to have some podcasts with people that have been into prison so we can hear what their journeys have been like about medicines. No one really talks about pharmacy in prisons. In fact, I've come across people that didn't know a pharmacist even existed in a prison. They are aware of pharmacy technicians because pharmacy technicians are medicating at the hatches in most prisons, and nurses, of course, but they're not aware that they can speak to a pharmacist about their medicines. So again, it was to bring that awareness that there is a career that exists in prisons, that there is a pharmacist, should you want to speak to a pharmacist in prison. But at the same time, we need to hear from people about their experiences. How are we going to know how to improve our services and the care that we're providing? It was just to really beat the stigma from all aspects.
So what I hear is that the goal for PPC would be to raise awareness for people to know about pharmacists working in prisons and career pathways and opportunities that might bring. Behind the scenes, you have been working with some of the prisons to see if foundation year trainees could have some insight into it. You're inspiring people even before they become pharmacists that there is actually a career pathway within that sector. That's amazing.
I think it's very important because then you think, at least I've been there and I've seen what it's like. Yes, I will consider it in the future, or actually, no, this is not for me. You wouldn't know that unless you experience that.
Sounds brilliant. Make sure to share this with your networks that careers in pharmacy present are available. Sometimes you just need to go and explore it and be curious about it. Okay, Kanisha, we've come towards the end of our first episode of PPC show. I've learned loads around prison pharmacy, and I hope the audience have found it interesting as well. The last question I wanted to ask you is, have you got any advice for pharmacists, pharmacy technicians, or students in this area if they want to learn more or get in touch with you? If I'm listening and I've gotten interested and I want to get involved, what should I be doing?
Well, first and foremost, you need to be following PPC on LinkedIn. You can message me on LinkedIn and say, Kanisha, this is what I'm looking for, or can we have a conversation? I'm very open to have a conversation with anyone. You will have my attention if you are curious. So don't hesitate to reach out. I would also say, if you are looking to get some work experience, there's no harm in reaching out to any local prison pharmacy team and see what they say. The worst that someone's going to say is no. And I'm telling you now, I definitely had a few no's before I got my experience. But if you are finding that you're not getting anywhere, get in touch. If ever you are in that situation where you do get the opportunity for work experience, don't be intimidated. Just say hello to everybody. You will get more out of people through kindness, and I'm sure you have experienced that yourself. So just say hello.
What an amazing finish of our first episode with a just say hello. If you're with an interest in diversing your career and you've become more interested in prison pharmacy, follow Prison Pharmacy Connect on all the platforms that Kanisha is available on. Please share it with your professional network, your friends, or if you've been in prison yourself and you would like to share your experience around medication or pharmacy in that setting, please contact Kanisha. Who knows, you might come on the later episode of the show.